I'm Dr. Sharjeel and you are watching my YouTube channel. Now today I am presenting you a very rare type of squint in this 25 years old male patient. Is my cousin. Now if you remember my words in my previous videos, that always examine the patient's whole body and never jump right towards the eyes. Now let's look at what is shown. You can see that the right eye is in exodeviation. On Hirschberg, the deviation is about 70 prism diopters, and if you look at the head, you can see scar mark. Now that can give you a hint of head trauma or surgery. He is maintaining fixation of the left eye and right eye is deviated. And now I would like to check his convergence. And on convergence, only the left eye is converging, whereas the right eye is not moving. So it means that convergence is absent in this patient at the moment. And now I'm checking the ocular motility, and ocular motility is full. There is a little bit limitation of the right adduction, but otherwise motility is normal. And during the motility examination, I was also asking him that whether he is experiencing double vision or not, and he was not observing any diplopia. His vision, his best corrected vision is 6/9 in both eyes. And now on the cover test of the left eye, the right eye has taken fixation, but as we perform uncover test of the left eye, it quickly takes fixation, which tells us that the left eye has got better vision and left eye is a dominant eye. Cover and cover test of the right eye shows no movement, which also confirms that the left eye is dominant. But as I have already mentioned that the patient's vision is 6/9, so vision is, in a squint patient, if vision is better, you should always rule out alternative squint. Now with cover test of the left eye, right eye not only takes fixation but also maintained it. Patient told me that he can maintain fixation of the right eye voluntarily for some time, even after blinking, but he then feels mild double vision while maintaining right eye fixation. The patient is my relative and I know him personally. He had straight eyes before and got a terrible RTA 2 years back and was in coma and hospitalized for many months. So he developed now traumatic alternative exotropia with left dominant eye and good vision in both eyes. Now it is an extremely rare condition, traumatic alternative exotropia. I have seen lot of congenital alternative squints, but this is the first time I am examining the traumatic alternative exotropia. Now regarding management, as you know that when we straighten the eyes of congenital alternative squints, patient develop temporary diplopia. Now in our clinical practice, that diplopia disappears in some patients after a few days, in some patients after a few weeks, and in majority of the patients after 1 or 2 months. But we don't know whether in this traumatic alternative squint that diplopia will remain or it will disappear. So for that we have to operate him with adjustable sutures, so that if he developed intractable diplopia, we can reverse the procedure. Thank you very much.